Hello and welcome to WVU Medicine Tuesday Talks. I'm your host, Mary Ravazio Menard. March is National Multiple Sclerosis Awareness Month, and nearly 1 million people are living with multiple sclerosis in the United States. MS is an autoimmune disease affecting the brain, spinal cord, and optical nerves. It causes a variety of symptoms that can flare up and then subside over the course of days, months, or even years. Today, we're talking with Dr. Eric Seachrist, a neurologist at the WVU Rockefeller Neuroscience Institute. Dr. Seachrist not only treats patients with MS, he too has been diagnosed with it. Welcome, Dr. Seachrist, to Tuesday Talks.
Thanks for having me.
It's good to have you here. If you have any multiple sclerosis questions, just submit them in the comments section below and we'll try to answer them live. Okay, so I always like to start with the basic stuff first. So tell us, first of all, what exactly is multiple sclerosis?
So multiple sclerosis is an autoimmune disease in which your body attacks itself. And the way that it presents is it can hit any part of the central nervous system, which that's going to be the brain, spinal cord, and then the nerves that go to the eyes. So you can get a lot of different symptoms. So it is a diverse disease, and everybody's a little bit different that has it.
No, it's very different for different people.
Mm-hmm.
Okay. So what are the symptoms of multiple sclerosis?
So kind of the symptoms are two different categories. We have the symptoms that people deal with every day, and then we have the clinical attacks that help make the diagnosis.
Okay. So let's talk about the day-to-day symptoms first.
So the day-to-day symptoms, the most common symptom is fatigue.
Okay.
So about 90% of patients with MS will have fatigue. However, it's a very nonspecific. We can have fatigue from anything.
Yeah.
So it doesn't help you make a diagnosis.
Okay.
Brain fog. You can have neuropathic pain, trouble walking, trouble with your bladder, trouble with your bowels, vision, speech trouble. I mean, it's endless list.
Wow. And what is you were talking about the medical attack, clinical type of symptoms?
So kind of episodes that would lead you towards a diagnosis of MS are going to be pretty clear. It's kind of hard to have these symptoms and not have any idea.
Okay.
So the most common is optic neuritis. So this is when you have
What is
vision loss in one eye. So the nerve behind the eyeball gets inflamed, and you have, blurred vision or partial loss of vision. You might not see colors very well, and then when you move your eyes, you tend to have pain.
Oh my goodness.
And all of these attacks, they'll last at least 24 hours, but typically they'll come and go over a period of a day to a few weeks.
Wow. So then what are considered the first signs of MS?
So that's one of the biggest is transient vision loss lasting more than a day, seeing double when you look a particular direction with your eyes, and that lasting for several days then going away, weakness on one side of the body, numbness on one side of the body, and then trouble walking, trouble with your bladder. Those are kind of the biggest ones.
Okay. Now, we mentioned earlier that you too have been diagnosed with multiple sclerosis. Can you tell us a little bit about your story and how you found out that you had multiple sclerosis?
Sure. So I was in my last year of neurology residency. So I was about to graduate.
Oh my.
And oddly enough, I'd already agreed to take over the MS clinic.
Really?
Before that happened. Because I always had a strong interest in it before this. And then the first thing I noticed was I was taking a hot shower and I couldn't feel hot in my entire left leg. And then I scratched my leg. It didn't feel scratchy on the left. Scratched the right. That feels scratchy. Okay. I just ignored it, of course.
That's what I would do.
Sure. And then over the next few days, I noticed it felt like my right knee was giving out. Like I had some trouble going up and down stairs, and still mostly ignored it, blamed it on a knee, even though I had no pain. And then by the 5th day, I had trouble signing my name, and then I could no longer make a fist with my right hand. I couldn't make a fist, I couldn't spread the fingers out. at that point, I needed to get checked out.
Yes, that sounded like that like escalated rather quickly too.
Yeah, and that's the typical kind of relapse is you have symptoms evolving over days, and then they tend to peak, and then they gradually get better over time.
Okay, so you had these symptoms, and then you were like, well, maybe I better get tested. Were you thinking MS, or were you just thinking, I better figure out what's wrong?
Initially, I was not, because I had ignored the symptoms so well that I forgot about the leg, I forgot about the other leg, and all I knew was the hand, so I thought it was maybe a pinched nerve or something, something less concerning, and then I was kind of trying to do an exam on myself and noticed that my reflexes were increased. I had one of my colleagues come and do an exam, and they saw those signs, and then that's when I knew it was a central problem, which is going to be brain or spinal cord. And it was much more worrisome.
Oh my gosh. So do they do any kind of, how do they diagnose this? Do they do, or is there a specific test that's done?
So anything neurological, it's a clinical diagnosis. So we need to have a good story, and we need to have an exam that fits, and then everything else we do is just a support.
Okay.
So my story and my exam sounded like a spinal cord problem. So then we looked at MRI of the neck and saw that I had a lesion kind of in the lower part of my cervical spine. And that was typical of transverse myelitis, which is one of the attacks of multiple sclerosis.
Oh, okay. And this is all right before you're going to finish
Sure.
medical school and your residency. Yeah. Oh my gosh. Wow. So what happened? How did you deal with all this? And were you able to you obviously were able to get treatment that helps you deal with everything, right?
Yeah, so I ended up in the hospital at Ruby under the neurology service. I was actually supposed to be on call that night. I was just like, okay, I'll come on in.
Terrible irony, terrible.
And then I got steroids, high-dose steroids for 5 days, and that helped the symptoms get better faster. And then I did some physical therapy, and within a month or two, I felt totally back to normal.
Wow.
And then it was just kind of following from there. At that point, I had a spinal tap too, so I can relate that when I talk to patients.
Oh, yeah.
And when I left the hospital, it was probably not MS because it was just one event and no other things were found. But at the follow-up scans at the year mark, there were new lesions, and that made the diagnosis.
Oh, wow. Okay. Well, so what is the treatment for multiple sclerosis? Because it's my understanding it has changed dramatically with the last 5 or 10 years.
Mm-hmm. So, I mean, the acute treatment is mainly steroids. But how we control the disease itself is completely different than it used to be.
Okay, how's that changed?
So the very first medicines came out in the 1990s, which if you think about medical therapy, think about stroke, aspirin's been around since like the 1800s or something.
Yeah.
And it's still the main treatment. MS, we're talking 30 years, and that's as long as we've been able to treat it. And so we went from shots that were really not that effective but quite safe, and then we added pills, and now we have highly effective therapies, mainly infusion therapies, and they are actually quite safe. So it's within the past 5 to 10 years, we not only have medications that work very well, but are also very safe.
And are these new drugs with the infusions that we didn't have 5 or 10 years ago?
Mm-hmm. Yeah, most of these are new, especially the B-cell therapies. And there's 2 of those that we use quite a lot.
And these don't cure MS, but they help control the symptoms of MS? Yeah,
so the role of disease-modifying therapy, that's one of these drugs, is to prevent new relapses and new inflammatory lesions in the brain and spine. And the medications now do a very good job of that. Now, you can still have the day-to-day symptoms, because especially if you had them to begin with.
Okay.
And there may be some progression that happens too long-term. It's still a little bit early to know for sure. But as far as controlling the disease itself and preventing relapses, and the main goal is to prevent disability.
Right, right.
Every time you have one of these events, you may not fully recover.
Oh, my.
So the best way is to try to prevent as best we can.
And it sounds like that's what these therapies are doing. I mean,
Yeah.
they're help. I think we were talking about, you said it's multiple sclerosis is now a disease that can be managed.
Yeah, and the vast majority of people, it's a chronic disease. We can't cure it, but we can greatly control it. Similar to diabetes.
Oh, that's a good
So
analogy.
That's how far we've come with this, thankfully.
That's like a million miles, isn't it?
I mean, before the therapies came out, it was about 60% of people that were diagnosed with MS would be in a wheelchair.
Ugh.
And now, I mean, most of the patients that were starting on good medicines from the beginning, we're not seeing it.
That's great. That's great. Do we know what causes multiple sclerosis?
That is a great question. The short answer is no.
Oh, no. Okay. I kind of suspected that, but I had to ask.
There's a lot of theories, but most likely your body responds to some sort of environmental trigger, whether it be an infection, whether it be something, and just gets very confused. And that trigger causes your body to start attacking itself.
Wow.
That's just kind of autoimmune disease in general.
Yeah, that's the MO of the autoimmune disease, huh? Does it run in families? I mean, can it be hereditary?
Not exactly, not the way in kind of a lot of other diseases are. What we do see is that MS clusters with other autoimmune diseases in families. So someone might have thyroid disease, someone might have lupus, somebody has MS. It's uncommon where everybody's got MS. That's
Okay.
really unusual.
So just like other conditions in the same family of
Yes.
autoimmune diseases. Okay. Is there anybody that's more likely, I mean, who's most likely to develop MS? I mean, is there a profile or?
There is. So the most common characteristics is going to be someone that's younger. We're talking probably between the ages of 20 and 45.
Wow.
3 times more likely to be female than male. And typically people that live in northern climates. So
Really?
if you live real close to the equator, probably a less likelihood.
No kidding, huh?
Yeah.
That's
So kind of if you think
interesting.
about Canada, Scandinavian countries, that's kind of the belt of MS essentially.
Oh, wow. That's interesting. Who knew? Climate would have so much to do with that. All right. What are there different types of multiple sclerosis?
There are. The main one we talk about is relapsing remitting. So you have an event, it recovers, maybe not all the way, and then in between events you are stable. And then you have another event, and you go back and you're stable. Over time, patients with relapsing remitting can develop secondary progression. So that's, you go from these attacks and normal in between to getting worse in between. And that tends to be a later stage of the disease.
Okay.
And another reason why treating earlier with better therapies helps prevent that too. And then the worst version of MS is what we call primary progressive. So that is from the very beginning, just getting worse.
Wow. Is there more of the primary or more of the first one you were talking about?
Relapsing remitting is by far the most common,
Okay.
thankfully.
I guess that's kind of a good thing.
Yes,
Yeah. Yeah. Okay. You did mention earlier, just because you have MS doesn't mean you're going to be paralyzed.
Well, of course not.
Yeah.
And definitely not with the therapies that we have.
That's really made some big changes. We already talked about the different treatments for MS. Can you just, and you just touched on it a little bit, why is early treatment so important? Does it make that big of a difference?
It does. And it's not just early treatment, it's early treatment with good medicines. We know what will happen to people if we don't do anything. And unfortunately, what we do see time to time in the clinic is someone had an event 10 years ago, they felt fine, they never had another event, they thought they were doing okay.
Yeah.
By the time we see them again, they have lots more lesions throughout the brain and spine, and they're already having disability. And they've already started progressing. And those are much harder to treat. The purpose of early treatment is to prevent relapses, so that helps prevent disability from that angle, and also delay or prevent progression.
Can any of these treatments reverse progression?
At this point, no. That is
Okay.
a big topic that
Yeah.
everyone's trying to get. I mean, there's things that we can do to, as patients that you can try to do, and that's, staying healthy otherwise. One of the worst things you can do with MS is smoke.
Ugh.
Staying active, there's not a specific diet for MS, but just eating healthy in general. So if you take care of yourself otherwise, that definitely makes a big difference.
Okay, good to know. Can you, and you are part of the multiple sclerosis team at the Rockefeller Neuroscience Institute. Can you talk about the experience of the team at the Rockefeller Neuroscience Institute in treating multiple sclerosis?
Sure. So we have in our clinic right now, there's myself and Dr. Ward, who's the clinic director. We've been doing this for a while. Then we have two APPs with us. We have an extremely experienced nurse manager who helps us get drugs approved when we otherwise couldn't. We have a pharmacist with us, and then we have all the folks that work with us with psychiatry, with testing people's memory, which managing those aspects, physical therapy. It's nice that we have everything under one roof.
Yeah, and if you get a multiple sclerosis diagnosis, you don't have to travel out of state to get really good treatment.
Certainly not, and I can speak from experience
Yes,
being
you
the
can.
patient.
Yes, you can.
So I actually did travel out of state for an opinion. It would have been better if I just stayed.
You don't have to mention names.
Certainly won't. I think what we do and what Dr. Ward and I really try to do is treat every patient individually and listen to each story and do our best to make decisions together with the patient. And I think that makes a massive difference in a disease like this where everybody is completely different.
Yeah.
And somebody's goals are different than somebody else's goals.
What works for one patient might not work for another.
Exactly.
Yeah. We've got the multiple sclerosis walk coming up.
We do. So the National MS Society, which they do a lot of really great work, and really great resource for information online because there's a lot of bad information.
Yeah,
so that's
we
a
were
good source.
Yeah, we were talking about that. So where do we want to go for the good information?
National MS Society is really, really good.
Okay.
And they have patients who have MS who will actually work as navigators, and you can call them and they'll just kind of talk you through everything too. Really excellent resource, and they do research as well. So we are doing, WVU Neurology is going to participate. We have a team in the walk, and the walk is going to be on April 15th here in Morgantown at the Coliseum.
Okay. And you can check online, just Google
Yeah, just
MS Walk, Morgantown. And you told me this is a walk. It's not a run, right?
Yeah, it is not a competition. This
No.
is just a walk.
Yeah, we're just creating awareness. We're
Yes.
not trying to set new records in speed in the hot sun. Okay, all right. Before we go, I always like to ask, what's the most important thing you want our viewers to know about multiple sclerosis?
If you're worried about it, if you think symptoms could be associated, get it checked out.
Okay. Don't put it off or
Don't put it off.
rationalize.
Yeah. Don't be like me. Don't
Yeah, I was just
ignore it
going to
for 5
say.
days.
Don't do what I did. Do what I say.
And that's the key too, because even I'm a neurologist. I'm supposed to be able to recognize this, and it's very easy to ignore things in yourself.
Yeah,
But
it is.
There's a point where it becomes really obvious something's not right. And it may not be MS, but it's really important to make sure it's not.
All right. And we've got great resources here for treatment at the Rockefeller Neuroscience Institute. Right in our
We do.
backyard. All right. Well, thank you so much for sharing all this great information with us. And I think there's some hope here, isn't there?
Oh, this is having a diagnosis of MS, it's not fun, but I mean, there's so many things that we can do that it is not a life-altering disease. And that's what we try to do in the clinic. You live your life, and we will work around you to keep you as best that we can keep you.
Excellent. Well, thank you for all the good information and giving us hope, too. Definitely.
Sure.
Thank you. That brings us to the end of this edition of Tuesday Talks. If you're looking for more information on neurological treatments, visit wvumedicine.org/RNI. And join us on Tuesday Talks on March 28th, when we'll talk about traumatic brain injuries with neurosurgeon Dr. David Adelson of the WVU Rockefeller Neuroscience Institute and WVU Medicine Children's. I'm Mary Ravazio Menard, and on behalf of Dr. Seachrist and everyone at WVU Medicine, thanks for joining us and have a great day.